Hi everyone. Since the treatment for COVID infection is not optimal at this time, and since we have not found any effective vaccination yet, we have to rely on proven preventive measures other than home confinement, wearing the mask, or observing social distancing. I want to discuss in this presentation what we can do that is simple to follow and will protect us based on the research and studies that were done in the past few months. The modifiable factors to prevent COVID mortality are the following. Obesity, unfortunately, results in over 15 chronic major problems, and COVID infection also has a tendency to affect these patients. These patients get hospitalized in increased frequency. The hospitalized patients go to the ICU, and patients who are admitted in the ICU have increased mortality. High blood pressure also causes damage to the inner lining of the arteries, which we call endothelial dysfunction, which increases the tendency for the blood clots to stick and cause significant blood clots, resulting in heart attacks and strokes. Diabetes is well known for multiple major problems, including increased COVID mortality and morbidity. Smoking, as well as the people who do not exercise and lead a sedentary life, also will have increased mortality. The information what we discussed in the previous slides are reported in the British Medical Journal and by Yale University. As you see here, as we grow older, the incidence of mortality and in hospitalized patients significantly increase. For example, if you see between the ages of 5 and 17, the incidence is 3.1 in every 100,000 patients. But the same 100,000 patients, the mortality increases to 329 for the people who are between 75 and 84, thereby increasing it 100-fold. Over the age of 85, the mortality increases by 160-fold. CDC reports that 8 out of the 10 COVID deaths are reported in United States are the adults 65 or older. Now we can discuss as to what we can do to protect us and prevent mortality. Zinc is supposed to prevent hospitalization and mortality. The recommended dose is 50 milligrams per day. As far as zinc is concerned, 18 randomized controlled trials were performed in which 1,781 patients participated. Apparently, they found out that zinc inhibits replication of the virus. In 2010 study in Netherlands, zinc inhibited a cousin of COVID infection, COVID virus, called SARS virus. In another retrospective study of hospitalized patients treated with zinc, these patients were treated with hydroxychloroquine and zinc. When they reviewed all the patients who were admitted in the hospital, they found out that these patients had increased discharges, reduced mortality, and they had reduced transfer to hospice care. Amongst the food that contains high amount of zinc are meat, shellfish, chicken, etc. Amongst the vegetarian food, fortified breakfast cereal, beans, nuts, seeds, all of them have high concentration of zinc. But in reality, vegetarians need 50% more zinc in their food. The Center for Evidence-Based Medicine reported, along with the University of Oxford, that vitamin deficiency increases the COVID mortality. Several studies have shown that the patients who have low vitamin D have significant morbidity, which means that they are hospitalized for prolonged amount of time, they are much sicker, and they get transferred to ICU, and they also had higher mortality. The vitamin D prevents cytokine storm, in which the patient's immune system overreacts and attacks our own cells and tissues. That is one of the modality with which patients die at the hospitals. As you see in this slide, numerous research reveal that low vitamin D is associated with mortality with COVID infection. The UK research showed increased mortality in 20 different European countries. Northwestern University in the United States also had found a link between vitamin D deficiency and elevated CRP, which has a poor prognosis. In Indonesia, there were 780 cases of documented vitamin D deficiency amongst COVID deaths. Similarly, vitamin C also reduces the mortality by reducing the oxidative stress caused by the virus, and thereby reduces the severity of cytokine storm. This is a storm which occurs in the ICU patients, and the patients have septic shock and then they die. This medicine prevents that. Vitamin C also helps with the growth and spread of lymphocytes, which are the key type of white cell which attacks the virus. Vitamin C also prevents to be very effective in suppressing the inflammatory process. It was evidenced in H1N1 virus epidemic. 28-day mortality was definitely lower in the patients who were treated with vitamin C. And these people spent reduced amount of days in the hospital and in ICU. The next over-the-counter medication that helps to protect the COVID patients is N-acetylcysteine. Oxford University and Center for Evidence-Based Medicine jointly recommend N-acetylcysteine supplementation. Cleveland Clinic also had published an article in which the role of supplementation of ascorbic acid, that is vitamin C, zinc, vitamin D, and N-acetylcysteine prevent the deterioration of the patients with COVID infection. Memorial Sloan Kettering Cancer Center's research revealed that the N-acetylcysteine supplementation is definitely protective. It increases the lymphocytes, which is well known to attack the viruses. It also is a mucolytic, which means that the thick mucous membrane which occurs in the lung of these patients, this supplement destroys them and dissolves them so that the patients can breathe better. The commonest cause of death in COVID patients is uncontrollable formation of blood clots, which causes heart attack, stroke, and blood clots in the lungs. There is a there is a factor called von Willebrand factor, which is the most important reason for the blood clotting cascade. The N-acetylcysteine interferes with the disulfide bond and thereby reduces the clot formation, which prevents death. Several vascular surgeons have observed that when they were trying to remove the blood clot from the arteries to prevent strokes in the patients with COVID infection, the blood clots are continuously being formed despite the fact that the patients are getting intravenous blood thinners. They have never seen this kind of phenomenon in the past. And it appears that the N-acetylcysteine has an ability to cause these clots to dissolve very easily. There are several evidence in which N-acetylcysteine, when given in intravenous route in ICU patients, the oxidative stress and inflammatory response were dramatically brought down, thereby reducing the cytokine storm, and septic shock can be prevented. This National Institute of Health publication also gives us another way N-acetylcysteine works in the patients with COVID by stimulating the proliferation of T cells, which support the immunity of the patients. These cells reduce the inflammatory pathway and oxidative stress as well as cell death. This National Institute of Health publication also mentioned about some of the research which clearly gave the evidence in that the N-acetylcysteine prevents the COVID infection from progressing to severe disease. Since N-acetylcysteine, when given intravenously, dissolves the phlegm which are thickened in the patients who are intubated in the ICU, there are faster recovery of these patients happen, resulting in extubation of the patient and ultimately helping the discharge of the patient from the hospital. CDC estimates that 20 to 40% of the patients who are hospitalized will develop ARDS. ARDS is acute respiratory distress syndrome, with which the patients are intubated and ultimately they die. 45% of these patients will die. The patients who have been exercising prior to the hospitalization, their immunity significantly enhances due to exercise. They've also found out that antioxidant extracellular superoxidase dismutase that is produced during aerobic exercise helps to protect against ARDS and also in other heart and lung diseases. American College of Sports Medicine published several articles which show very clearly the benefits of exercise. These exercise increases the muscle-derived cytokines such as IL-6, IL-7, and IL-15. IL-6 is shown to direct the immune cells trafficking towards the area of infection. IL-7 can promote the production of new T cells from thymus, which can go and fight against the COVID infection. Clearly, the exercise has proven to protect the people from influenza, rhinovirus, herpes infection, varicella zoster, and many other viral illnesses. We all know that during the COVID pandemic, there is significant stress, anxiety, depression, and PTSD in up to 36% of all of us. 95% of the patients reported that their moods improved after doing a structured exercise, and 63% of the patients reported being very happy despite the stress with COVID. Several research also point out that lack of sleep will alter the cytokines and affect the immune response. The Mayo Clinic article shows that we need 7 to 8 hours of quality sleep each night, which definitely builds the immunity which will protect us from COVID infection. I'm summarizing the entire presentation. First one is aerobic exercise is absolutely important. 7 to 8 hours of sleep is critical. Baby aspirin 81 milligrams once a day will prevent platelet adhesions and thereby preventing the heart attack and stroke. But we got to be careful. The patients with history of ulcers, bleeding ulcers, and macular degeneration should avoid baby aspirin. The patients who are already on blood thinners should not take baby aspirin. Vitamin C, 250 milligrams once or twice a day. Vitamin D, 2000 to 5000 international units every day. Zinc, 50 milligrams every day. N-acetylcysteine, 600 milligrams twice a day. In addition to all these things, the recommendations with which we have been bombarded, like stay at home, wear the masks, and social distancing are also equally important. Thank you for watching this presentation. We have announced universal flag for 2020. Look at the mask flying all over the world. Thank you very much again. If you like this presentation, please press like button there, and give your comments. Feel free to forward this to all your family members and friends. Thank you very much.